Hello, everyone. Welcome to Candid Conversations, real people, real stories, real impact, a podcast from 120 under 40, the new generation of family planning leaders, where we talk to family planning and reproductive health champions from around the globe and take a deep dive into current topics in family planning and reproductive health, as well as the personal journeys of our family planning champions, the challenges they faced, what excites them about the future, and advice for other up-and-coming leaders. We are thrilled to welcome you back for episode 8, where we will meet two more of our 2020 Ingenuity Fund winners, Alison and Andrea, and discuss their projects. Before we get started, don't forget to subscribe to our YouTube channel. The link will be in the description. And be sure to hit that notification bell to be the first to know about upcoming episodes. Without further ado, I'll allow our guests to introduce themselves and their exciting Ingenuity Fund projects. Welcome.
Hello, my name is Dr. Andrea DiMaria, and I am a 2019 120 under 40 recipient and an assistant professor in the Department of Public Health at Purdue University. Today, along with my colleague, Dr. Laura Schwab-Reese, I will be presenting our project titled A Content Analysis of Sexual and Reproductive Health TikTok Posts During the COVID-19 Pandemic, a Gen Z Experience, which was funded by the 120 under 40 Ingenuity Fund, supported by the Bill and Melinda Gates Institute for Population and Reproductive Health in Bayer. We have many presentation objectives that we will get to today. First, we are going to introduce you to our team and the purpose of our project. Then we will get into our rich research methods, ultimately landing on the results, findings, and implications, and leaving you with some ideas that we have for toolkit development and how we are going to disseminate the information from our study. The project was carried out by a team of interdisciplinary scientists. As co-principal investigator of the project, I was responsible for project oversight, which included directing our 9 undergraduate research assistants who helped with the project conceptualization, data collection and data analysis, and manuscript and toolkit development. These students joined us from various departments from across our campus, including the School of Nursing, the Department of Public Health, and the Department of Political Science, and beyond. I would like to give a special acknowledgement to Isha Nair, a junior studying biomedical health sciences, for her contributions in compiling this presentation. Now I'll toss it over to my collaborator, Dr. Laura Schwab-Reese, so she can do a brief introduction and lead us into the purpose and methods of our study.
Thanks, Dr. DiMaria. I'm Laura Schwab-Reese. I'm an assistant professor at Purdue University, and I'm a violence prevention researcher who focuses on how we can use social media to connect young people with appropriate, adequate, accessible resources. I was so happy to be able to contribute my expertise in social media to this project. As I think back to when we started to develop this idea, we were so heavily influenced by our students. They kept talking about TikTok. And so we wondered, could we leverage this time that they're spending on TikTok to start sharing evidence-based information? We ultimately decided for this project to focus on understanding and identifying reproductive health-related TikTok content and understanding the types of content and the ways that users shared that content. Using this information, our last goal was to develop a TikTok toolkit. Before I share what we found, I'd like to share about the data and the analysis. We started by focusing on reproductive and sexual health-related hashtags on TikTok. So that's things like hashtag period problems, where people use a hashtag to identify their video as being relevant to a specific topic. For each of the videos that we found, we abstracted the caption, the hashtags, the number of likes and comments, when it was uploaded, and the audio tracked. Next slide, please. We collected data for 16 weeks. Throughout this time, students identified the top 6 videos each week for the hashtags that we assigned them. As we went along, we noticed that the top videos weren't really changing. We saw the same videos as the top videos over and over. Eventually, what we figured out is that people actually use the For You page, which is a tailored feed of videos to navigate TikTok. Hashtags were incidental rather than critical to how people navigate. We decided, because we were having difficulty finding as many videos as we hoped, to add specific content creators to our data collection. We wanted to try to capture a better cross-section of popular TikToks. Then we analyzed the data using qualitative content analysis, which is a systematic way of processing large amounts of non-numeric data. So that's things like videos, conversations, and so on. We can use qualitative content analysis to help identify what's being shared, how it's being shared, and other patterns that start to emerge from the data. We spent about 3 months training those 9 students on how to create a code book, how to assess their consistency as a coder, how to apply themes, and how to analyze the codes, which ultimately led us to 3 primary findings. One I touched on a little bit earlier. That is, hashtags are not the primary way that users navigate TikTok. The TikTok algorithm creates a tailored feed for every single user. That makes it a little bit harder to jump onto conversations and to take advantage of popular videos, because you can't just add a hashtag to your video to join that conversation. Our second 2 findings are more content-based. We found that people tended to either share information and education or their personal experiences. When we looked at sexual violence TikToks, we found that these videos tended to feature women, although there were a couple of men whose videos became popular. We also found that sharing personal stories was very central to these TikToks. Women shared their experiences with sexual assault. They used paint to explain histories of non-consensual contact. So at the end of the video, they had a really powerful visual of all of the places that they'd been violated on their body. Or they sought to raise awareness about sexual violence by sharing their and others' stories. In the video on the right of the screen, you can see this content creator. She experienced sexual assault as a child, which influenced how she decides who gets to provide care for her baby. I'm going to go ahead and turn it back over to Dr. DiMaria to share more about the reproductive health and content creator findings.
Thank you, Laura. As we have mentioned, millions of TikTok users viewed videos from our targeted hashtags. Top videos and our reproductive health related hashtag were consistent over time, like the other videos. For example, only 11 videos appeared in the top 6 for hashtag birth control and only 10 for hashtag period problems throughout the entire 16-week collection period. Most of the videos fell into those 2 primary categories, the personal experiences and the informational content. Among the personal experiences, people shared stories such as IUD removal experiences, as noted in the video here on the left, of one user noting how she removed her IUD accidentally while removing a tampon during menstruation. Users also mentioned crafts such as painting birth control pill cases, or used humor such as celebrations of arrival of a monthly menses. In the informational content, dancing and demonstrations, such as OBGYNs inserting IUDs, were commonly used. Common topic areas across the videos included information on dangerous or unethical procedures, often noted by influencers or content creators, people raising awareness about harmful products, such as those marketed for genital hygiene, and normalizing aspects of reproductive health, such as conscious family planning methods. We also collected data from content curators or influencers. The 7 selected influencers that we followed had established an aggregate following of over 3.4 million individuals at the time of data collection. They effectively share medical information and engage with their large following via 3 main methods. The first being utilization of humor in their dissemination of medical information. Second, providing accurately sourced research and visually presented data. And the last be answering direct questions from their audience through the reply function that TikTok offers. Surrounding a common theme of accurately sourced information, the 7 influencers identified and tracked during the data collection period intermittently used hashtags, music, and structural elements. As seen on this slide, the content curator on the left was sharing content related to birth control methods, IUD insertions, and PCOS education, to name a few. In this example video, the content curator is explaining female reproductive anatomy and debunking a common myth. Let's take a look.
Well, your tampon gets soaked in water when you take a bath or go swimming. The vagina is not some open gaping hole that water can just flow freely in and out of. It's actually an elastic tube of tissue that's closed in on itself, but can stretch and expand to accommodate things like tampons, intercourse, and even babies. It's what we call a potential space. When you're in a body of water, the opening is closed around that string. The string can absorb a little bit of water that'll travel up to the tampon, but that amount is minimal. That tampon will not get soaked in bath water.
Results from our study suggest Gen Z uses TikTok to share messages about myriad sexual and reproductive health topics for millions of global users. Findings can be used meaningfully for teens and young adults, their healthcare providers, and their communities. This study provides new information on how a younger demographic discusses reproductive health information on TikTok. TikTok may be essential to reach young people with timely and factual messages. Healthcare providers, for example, can successfully spread awareness of reproductive health topics to a younger audience and are essential for the spread of accurate and factual information on TikTok. Study findings can be used to create a toolkit to assist sexual and reproductive healthcare providers and practitioners with effectively disseminating health information across a younger audience. In conjunction with spreading health information to a wider audience, increasing the publicity of conversations surrounding these topics will normalize discussions of sexual and reproductive health despite previous stigmatization. Platforms like TikTok may play a critical function in communicating sentiment and providing ways for individuals to interact with and co-create their experiences, especially during the COVID-19 pandemic. So from here, we plan to present our work like we are doing here and publish across a bunch of different types of journals to reach the diverse audiences that may be interested in the work. We're translating this research into action in their communities. We are going to continue to develop and disseminate our toolkit so that we can spread awareness about how people can use TikTok or learn from TikTok, such as lingo and about the audiences and who's on there, so that they can use the information appropriately in their practice and their community engagement, their education efforts, and beyond. And of course, like any good researchers, we will have more questions. We are not TikTok users or not part of the TikTok generation, so we have questions all of the time. And we have questions based on what we learned too, and we hope that you do too. So we will continue to explore how social media, including TikTok, can be used to better understand sexual and reproductive health experiences among a younger generation. Please get connected with us. You can find us on Twitter. You can find our university on Facebook. We are also on Instagram, and of course, you can email us with any questions you have about the work or to get connected to some of the outputs that are forthcoming from the research. Thank you so much for your time and attention today.
Okay. Hi, everyone. My name is Alison Hoover. I am a 2019 120 Under 40 recipient and a 2020 Ingenuity Fund winner. I'm based in Atlanta, Georgia, in the US, and I am pleased to be presenting my team's initiative, the Dignity PAC Project, launched with funding from the 2020 Ingenuity Fund on behalf of myself, April Ballard, and Anna Rodriguez. The Dignity PAC Project's purpose was to meet the hygiene, menstrual health, sexual health, and PPE needs of people experiencing homelessness in Atlanta, Georgia during the COVID-19 pandemic. Our original scope, we aimed to distribute 240 kits over a 6-week period, back when we all were optimistic that the pandemic would be a little shorter lived than it has turned out to be. Fortunately, 1 year later, we have provided now over 1,300 of these kits in our own community. And we have done that by distributing products using a shopping model in partnership with existing organizations. Key goals of the Dignity PAC Project. Our primary objective was to strive to address the acute and chronic hygiene, menstrual health, sexual health, and PPE supply needs of people experiencing homelessness in Atlanta during COVID-19. But a second and equally important objective was to evaluate and identify product needs and preferences among people experiencing homelessness and to communicate about those findings to a broader audience, including this one. So we're grateful for the opportunity to present to you all today. We integrated a survey into our efforts from the outset, asking recipients about what items they liked on the table, what was hardest to get, what was missing, and how we could adjust the way that we were distributing. Over time, we adapted included products to reflect these preferences, including seasonal changes and adjusted needs over the various phases of the pandemic. One major finding from our survey efforts was the need to stop pre-packing kits. We changed our distribution model to mimic shopping at a store, where we set out items and invited recipients to take the type and number of items they wanted. If we were at a fixed site, such as at a soup kitchen with a partner, we would usually set up a table. But from time to time, when we did street-based outreach, we would get a little creative and we would distribute out of the trunk of a car, as you can see in the photos here. So 1 year into the project, we have distributed over 1,300 kits. We have conducted 29 interviews alongside observation and key informant conversations. And excitingly, we also had the opportunity to support COVID-19 vaccine access among people experiencing homelessness. After realizing that that need was really going unmet and building upon the relationships we'd established doing this project, we were able to work in partnership with Emory University and a local street-based medicine provider to organize mobile vaccination clinics that have since administered 98 COVID vaccines to people experiencing homelessness in Atlanta. So, what kit contents did people prefer? Here is a table that is from our recent publication about the initiative, emphasizing choice and autonomy in personal hygiene, menstrual health, and sexual health product distribution to people experiencing homelessness in Atlanta, Georgia during COVID-19. Really rolls off the tongue. Published in Health Promotion Practice with the citation below the table. Our initial prototype was based on standard concepts of hygiene kits and included a variety of tampons and pads, flushable wipes, a bar of soap, hand sanitizer, 2 kinds of deodorant, a toothbrush and toothpaste kit, over-the-counter pain medication such as Advil or Tylenol, condoms, surgical face masks, and occasionally reusable face masks, a resource guide with information on services that were still available during the pandemic, a plastic grocery bag, and a first aid kit. The section below highlights the 3 products we removed from our initial prototype: a small garbage bag for packaging and menstrual product waste, shampoo, and a clear press and seal bag. The column on the right highlighted the 6 products we added after our initial prototype based on recipient feedback. And that included a washcloth. It supported washing with the soap we administered, mouthwash when water wasn't available for brushing teeth, a drawstring bag for hands-free, reusable, and private carrying of the items, lotion, razors, and Vaseline. On the bottom right, you'll see the 2 products we added and then removed that were described as useful by some, but were not popular, a comb and sunscreen. We actually had a few people laugh at us for the suggestion of including sunscreen. Just a nice moment to reflect on our own concepts of what's useful does not always reflect the needed wants or preferences. We decided which items to remove when we saw items having very limited uptake over multiple weeks or when numerous recipients directly stated that a product was not useful. The unpacked distribution model has been a huge success. Pre-packed kits include every item, but when people pack their own, they almost never take every item. Some people only want 1 or 2 items based on their space or weight capacity, or simply based on preference and need. Recipients also commonly remarked that they, quote, didn't want to be greedy and take more than they needed. This notion that if you set it out, everyone will just take everything they can get their hands on did not prove to be true at all. Offering unpacked kits reduces potential physical and financial waste of unwanted products, as well as lessens the administrative burden of packing itself, all while offering a much more dignified, empowered, and humanist approach to this work. In addition to the preference for certain items over others, a finding I want to emphasize is that people certainly have individual product preferences, and they aren't always what you would expect. For example, when given the choice between a deodorant that is commonly marketed to women and a deodorant that is commonly marketed to men, numerous men chose the deodorant marketed to women, saying that it smelled better. People also often took products to share with others in their life, including men and other non-menstruators taking period products for the menstruators in their life. Our big takeaway from this was plainly, don't gender kits. It doesn't actually yield appropriate outcomes. Lastly, we can't overstate the value of centering kit recipients and forming complementary partnerships in the success of this effort. Soliciting feedback from recipients and working with established local organizations taught us critical lessons and guided us in modifying our approach. Working in tandem with others meant we more comprehensively meet recipient needs and we maximized our own impact. Ultimately, what resulted was better ethically, logistically, and economically, all because we listened carefully to those at the center of this experience. Looking forward, we are continuing to seek out funding opportunities to keep this program going, particularly as social distancing requirements remain and other support services are still limited for those experiencing homelessness. For us, this includes launching a website, applying for additional grants, and pursuing corporate sponsorships to link our project partners to long-term solutions. But our objectives are adjusting as well, in line with the critical insights we continue to gather. Our efforts are helping to address a need, but in order to be fully in line with our principles of dignity and autonomy, what really needs to come next is working to integrate these products into fixed, accessible sites for people experiencing homelessness to get these products on demand. Us showing up fairly regularly, but still sporadically at these different sites is not the right way to really make sure that people have the products when they need the products. To that end, we have just started working with the principal contractor for the City of Atlanta's work with people experiencing homelessness to conduct a needs assessment of the menstrual products available to people experiencing homelessness as part of targeting effective technical assistance efforts directly with those partners. We are extremely grateful to the kit recipients that shared their feedback with us, as well as our advisors, colleagues, and volunteers as part of the Dignity Pack project. A special thank you to the Ingenuity Fund, Bayer, and the 120 Under 40 program for the opportunity to do this work. You can find Dignity Pack on Twitter and Instagram at Dignity Pack. And please feel free to reach out to myself or my co-founder, April Ballard. Our emails are posted here. We welcome thoughts, ideas, opportunities to collaborate. It's really great to be here with you all. Thank you so much.
Thank you all for joining us today for our conversation. I am very much looking forward to discussing your projects a little bit further, as well as your personal journeys and maybe some challenges you faced in your career so far. My first question to kick us off is, what is the most exciting or interesting aspect of your 2020 Ingenuity Fund project, whether it be something that you weren't expecting, an outcome that was really impactful for you? Anything like that would be really interesting to hear about.
Sure, I'm happy to kick it off. I think, as a professor who mentors students on research projects, especially the research projects that I develop along with them, I think this project was especially exciting because we had such a large team of undergraduate students who were really educating us on TikTok. This is a huge part of the culture that they have. And they were also learning about this app that they'd been using for a while and knew very little about themselves. And so I think that was a really rewarding experience for me to be able to mentor the students and to teach them skills and see how they can learn and apply the information they're learning from this technology tool that they spent so much time on, especially during the pandemic. The amount of time spent on TikTok significantly increased during the shutdown, especially. And so it created a really unique opportunity for us to have engaging conversations with the students and have them see how we can translate research on something as fun as TikTok and turn it into some high quality work that others can benefit from. So we continue to see that too as we're working on compiling all of the findings. And so the students continue to be inspired. So that certainly keeps me motivated to keep on doing this work.
I think it was also really interesting to see how different social media platforms function. Right? I study social media. I'm pretty, I'm not 20, so I'm not on TikTok all the time, but I thought I knew how TikTok worked. And then to learn that everything comes from that For You page. We ask a student to help us learn how they navigate. And so, show us what you're doing. And it was basically, they start the For You page and they just scroll, which I think challenges how we can get information out to young people. The TikTok algorithm is this little black box, and we actually saw that there were pretty significant changes throughout our data collection period. So I think it challenged me to keep asking questions about how social media works and how we can get messages out, even though I spend a lot of time thinking about social media and I thought that I knew how TikTok worked.
Did you just have the easiest time getting research assistants by putting up that they would be on TikTok as part of their research assistant position? Line out the door? Like, what are we talking?
We had so many students. We did end up having to turn away students because it got to the point of like, Dr. DiMaria and I both love working with undergrads. They're excited, they have great new ideas, but there were only so many people we could coordinate with at a given time. 9 was, I think, the biggest team I've ever worked with, and it was a lot sometimes.
Laura, I'm also not 20, and so that makes TikTok its own like black box for me as well. But as someone who has studied social media and your own understanding of it, how is TikTok different from the other platforms you've worked with and studied, and how do we need to treat TikTok differently in our work?
I think in many ways, TikTok is a more passive platform. I mean, so if we think about Twitter and Facebook, which are admittedly kind of the, it's not MySpace, but it's the earlier generation of social media, there tended to be a lot of interaction. I mean, we're posting on their pages, we're interacting on Twitter through likes and retweets and comments. But I think for most people, TikTok is pretty passive. The For You page shows me this video and then I just keep scrolling. I think in some ways it really speaks to how well the algorithm works. I think our students talked a lot about kind of getting into a TikTok hole where they sit down, they open the app, and then it's an hour later and they've watched 60 TikTok videos. So I think that's a big change, I think, from how we traditionally think about social media.
I think, trying to just understand it through studying it and using incognito ways so that things we were doing on our own devices didn't influence the videos that we were collecting organically through the search. I think after watching so many too, I'm a little TikToked out. I can see how a younger generation enjoys it. And even since our study was conducted, the TikTok videos were only up to 30 seconds at the time we were collecting data. And now they can be up to 3 minutes. So I'd be even interested to see, how that has changed the TikTok game and what types of differences we might see, especially with the educators. So I'm interested to see, maybe the professors and the experts can take over TikTok, and then I'm sure it's going to push the younger generation into creating some other form, since the old people, quote unquote, take over every platform. So I'm sure that there's already the next best thing out there. Maybe I'll join that one, since I may not be researching on it. Do you have a TikTok, Allison?
I don't, because I'm too old. It is when we launched the Dignity Pack project, and it is in some ways connected to Emory University, principally by the fact that that's how all of my collaborators and I found each other, was during our respective studies. And Emory wrote an article about us, and an undergraduate student reached out and said, "I notice you have no social media presence. Can I help you?" And we said, "Oh my gosh, yes." And so the reason we have an Instagram, shout out to her, and I think it was our first meeting, and she looked at us and she's like, "Have you all ever thought about a TikTok?" And you should have seen the look on the 3 of our faces. Like it was like asking us if we had ever considered studying Arabic, or just something that felt like a true foreign language for all of us. And I think it's certainly, I have a lot of respect for those that are navigating an iterative and very sort of like real-time platform in the ways it's changing, and the ways in which it is ubiquitous and powerful. And it's my own challenge that I'm already obsolete. I will own that one. So I think it would have been a fun idea. Her idea was a dance involving products as part of education. So maybe one day, maybe now that this is going out into the public, we'll be held to it. We'll have to make one.
That would be awesome. I would love to see that. We actually recently spoke with one of our other 2020 Ingenuity Fund winners, June Lau, who also had some experience with TikTok, and she discussed some censorship issues with TikTok and with the algorithm. And that was a big challenge for her in her project because she is a sex educator. And some of that content, actually most of that content on TikTok as well as Instagram was also censored. So I would love to know if anybody has had any experience with that as well.
You know, if something was being censored or removed, then it probably wouldn't come up in the search strategies that we had. I would say, though, that I would be surprised because some of the videos that we have extracted from TikTok are very sensitive. The nature of the content is sensitive. The language might be considered sensitive or vulgar. The music for sure, because a lot of the users utilize music when you really break down those lyrics. So I don't know the ins and outs of the censorship, but I'd be interested maybe to learn a little bit more about that project because we could have absolutely missed important posts because they were censored before we were able to extract them on our daily methodologies. So that's really interesting to bring up. We'll have to look into that work because I think it would, influence maybe how we organize or interpret some of the results that we have.
I will say there was a moment during data collection that TikTok very clearly switched their algorithm. So we had been collecting COVID-19 related hashtag videos, and they, like everything else, were pretty consistent until I can't even remember, the middle of September 2020. There was an instant switch. I mean, all of those more informal, some of them were jokes, some of them were interpretive dances, all of those were gone, and it was replaced by more established organizations, the WHO, the CDC, which from a health perspective, it's like, yes, people are going to see this really great evidence-based information. But it also does raise questions about who gets to see what, when, where, and why.
I think as much as I would love to continue to talk about our own work, I really am excited to hear more about your work, Alison. And I must admit that I have a personal interest because with some researchers here at Purdue, we've started to explore menstruation among people experiencing homelessness in our community. And specifically here at Purdue, we have a free tampon and pad policy and program on our campus, which then was adopted by the community that we live in, the city of West Lafayette. But across the river is a larger city, the city of Lafayette, who hasn't develop those same policies and programs. And that's really where a large percentage of our people experiencing homelessness are. And so we're doing something similar to your work. We're not doing as much as the intervention yet. We're trying to figure out a little bit about how people are experiencing menstruation while also experiencing homelessness and how service providers interact with them so we can create some change. So I would love to hear a little bit about how you united your collaborators and what advice you might have for people who are interested in doing some of this work, because I think it's really needed. There's not even much out in the publishing world besides a couple of pieces of work at the intersection of this, and yours is one of them.
Yeah, thank you for that question. I came to this work from a menstruation lens. I spent some time before starting my master's program at Emory in the Bay Area in California, where the population of people experiencing homelessness is just catastrophic. It is borderline dystopian in parts of Berkeley and Oakland, and it's really concerning. And I, being a researcher, was doing sort of an informal, I always had products in my bag and I would just stop and chat with any one female presenting about what they were doing, what might be better. We, through that process, learned, I think, that libraries are still a really undervalued option. They are open access. You can spend hours there without issue. There is access to a clean bathroom, electricity, internet. It's a really great opportunity to be reaching menstruators experiencing homelessness. And that was originally how I came to this work, and then started at Emory, moved to Atlanta, started talking to folks at Emory about, is anybody else interested in this? I wonder what would be possible here. Here's what I learned in the Bay Area. I wonder how much would translate here. I wonder what would be needed, helpful, and relevant in this space. Fortunately, got connected to a phenomenal professor. The value of professors cannot be overstated, who linked me with April, who is currently a PhD candidate in the Environmental Health Sciences program at Emory. And she and I met to talk about a research agenda originally, because as you're saying, Andrea, that there is just so little information out there, particularly in thinking about policy advocacy and being able to point to the need, the extent of the need, and what would be required to address the need. Having that kind of data would be a real asset. And that was our original plan. And we were working, we had talked to a couple other students. Anna Rodriguez, our co-collaborator, got involved through that way. And then our good old friend COVID-19 showed up on the scene, sent all of us home from school, and sort of looking at each other like, what good is a research agenda at this point? And I think so fortunately for us, this Ingenuity Fund opportunity came up, and we all talked amongst ourselves and said, okay, if not research, can we practice? And then we said, do we actually have to choose? So we did practice with this research component where we would start to say what's going on. But I mean, it remains, reaching menstruators experiencing homelessness is very challenging. A disproportionate of people experiencing homelessness are men. And then among those who are menstruating, or women, or trans, or non-binary, as many of us know, stress and malnutrition can stop menstruation. And so even among that group, they're not always menstruating, and their needs aren't always for menstrual products. So it's a very small group. And then within that, it's a very hidden group, which was part of, I think, why we were so excited to see non-menstruators take menstrual products. I don't think we think of them as an agent to convey products often enough. We so often just think about, how do we get it to menstruators from us to them? And there is such a great conduit here in partners or in friends from an encampment or wherever they're living that are clearly a fantastic agent. I mean, truly, I think it's probably about 10% of men that came to our table or our car were taking menstrual products. I mean, that's substantial. So we are really excited about that. I think the other thing I would advise for anybody else wanting to get involved in this too is the opportunity to think beyond pads and tampons when we think about meeting the needs of menstruators. It takes me half a pharmacy to survive that once a month. Like I'm in pain. Painkillers are an essential part of how I continue to go about my day and take care of myself. I value so much my heating pads, my little thermocare that just make it doable. But when we think about meeting the needs of menstruators experiencing homelessness, we're so often focused just on pads and tampons. And I would love to expand the discourse to how do we think about pain management? That is so valid. You cannot go about your day, provide for yourself, continue your work if you are in substantial pain. And thinking about managing that just as essentially as we're thinking about managing bleeding, I think are really important, really underrepresented, and rarely asked questions that we would all benefit from starting to involve in our discussions in this work.
So what do you think would be some more of those sustainable options? Because you mentioned that, in your work, that finding more long-term solutions. And I'm even thinking about, how could Purdue's program be expanded to move beyond tampons and pads to really get at some of the other things that coincide with bleeding. And we've heard, a little bit in our sample about even different types of pads, panty liners versus overnight pads, or just thinking about the different types of things. So ultimately, how do you think that this could be sustainable over time in your community or in other communities? What's it going to take?
Totally. A big one that we are also starting to focus on with the Dignity Pack project as just a foundational level for this work is bathroom access. I think advocated for expanded public bathrooms in whatever spaces you occupy is so essential. Staying clean is just as important. We all have leaks, issues, and wanting to take care of that. The dignity of being able to take care of that is really foundational and also an imperative place to begin. Another part of menstruation that we don't discuss very often is also the disposal of used menstrual products. particularly with people experiencing homelessness. And a lot of this can be addressed with a foundation of on-demand bathroom access. And so starting to open up that access point, does that look like having a nice long chat with your local Starbucks that is near a homeless encampment about being more willing to allow their neighbors to come in and use that bathroom, or whether it's about advocating for the city to install a public bathroom, or if it's working with the library nearby to make sure that they have menstrual products stocked and on hand. I think all of this work has to come in tandem with private, secure, clean bathroom access. Atlanta has kind of a funny public bathroom option. They're timed. So they have them in a park, but you can go in, you can use the bathroom, but at a certain point, that door is going to open, whether you want it to or not. And that's really kind of a half measure. I mean, can you imagine? That gives me such vicarious anxiety about that idea. So there is a public bathroom that's available at this park. Okay, good start, but we can always keep improving on these ideas. So I think all of the steps toward owner-controlled access to a private, clean bathroom is really an imperative next step toward that sustainability. And then libraries, man, I think libraries, they're kind of challenging because this is obviously not their mandate. This is obviously not the point of a library. But any work within that or other in your own neighborhood, what might a comparable space be that already has a good reputation of being a safe place and that already offers so many imperative services that might be expanded to make products available to menstruators is a really fantastic path forward.
I think you're making such a good argument for how they can be a partner in this work. So I'd love to hear if you have reached out to them, how they're responding, any suggestions for approaches to do that.
I did reach out in California, and their libraries, at least there, were under kind of a chain of command. And so while that individual library was open, they couldn't on their own implement something like that without agreement, permission, or whatever it was that they needed from up above. And then at that level, it goes beyond the branch to the district. And so the advocacy at that level is expanded and more lengthy. But I think just such a fun idea and worth pursuing going forward. Another thought we had, which I have seen in some communities, which I think is just such a fun idea, but really hard to take to scale. Have you seen those little free libraries with books? One of the ideas, I think this, somebody ran this as part of their Girl Scout troop somewhere in Atlanta or Georgia. I think I read about it in the news, but essentially a Girl Scout troop managed one of these little free pantries, and they kept it stocked with period supplies. And I think certainly when we've brought this up, there is a very common notion that, you stock it and it will be ransacked, and there's no way you'll be able to keep that stocked. And to that, I say, our experience says something a little different. I think, sure, it's possible from time to time it'll be swept out, but as in all things with the principle of scarcity, you just have to prove consistency. So I think the startup of that will be hard, and we'll have to acknowledge that a lot of products are going to move really quickly in a model like that. But as part of having that dignified on-demand access, having frequent small restocks until people feel confident in its supply and the sense of scarcity can go out the window, I think that will also be a totally viable opportunity as well.
I love that idea because I don't think I've really thought about libraries. I even, made a note, are we recruiting in the libraries? Because there are quite a few near the services that are accessed in our community. And I just, want to give you props because I think that menstruation is a huge issue that is not touched on enough in sexual and reproductive health work. I think that when we think about the people who have very little information or view this topic as so stigmatized, it prevents people from sharing their experiences or getting help for the experiences that they're having, or really prevents a lot of conversations that normalizes menstruation and being able to talk about it as part of overall health and well-being. So I think that the work that you're doing is important, and we saw it captured in some of our TikTok videos too, because we were looking at menstruation related hashtags, and these users had lots of experiences where they were sharing stigmatization, they were sharing some scary things related to menstruation, they were sharing the negative impacts it has on their life, but also the positive impacts too. So there's kind of like two sides of the stories and how they were using this period problems hashtag. They were kind of making it their own and feeling empowered to be a menstruator, but then also sharing a lot of the negative things, the perpetuated myths that you might experience, the questions and concerns about how to use menstruation related products. So I hope more continues to come out related to menstruation. I think when in the world of public health that Laura and I live in, it's a huge public health issue. Menstruation experiences can prevent education. It can be an issue for people experiencing period poverty. It can be a way to discriminate against people in certain communities and cultures and religions. And so I'm looking forward to more of this work coming out, because I do think it is an untapped topic in the field.
It's also just a huge cost inequity. I think we let that one slide a little bit. It's expensive to bleed every month. Like, that's not a small cost. And it's one that is just plainly assumed without much protest by those who do menstruate. And that, I think, it is so fantastic that Purdue is offering free products. It's just silly that they're not always free. But I applaud you all for doing the right thing in that regard.
Yeah, and like you said, there is concern about people going into emptying out all of the machines. So it was a student-led initiative here. And I always say empowered students can really take on the world, especially the university world. And that's certainly what happened here. And they did a small feasibility study to see what would the cost be in a single campus building. And they worked together with some strong faculty advocates who put it through. And it first was a resolution to be in all of the women's and gender neutral restrooms. And that happened in early 2020, just before our shutdown. And then most recently, in the spring of 2021, that was approved to be expanded to men's restrooms as well. So now everywhere in our campus buildings. It hasn't been quite implemented yet. There's still a lot of questioning about why that's a thing. So it takes a lot of education and good partnerships across all people on campus to make it happen. But yeah, it's really exciting for a place like Purdue and pretty, not rural Indiana, but I would say, just as a suburb kind of city kid, it is certainly not a city environment. And so it's pretty impressive what Purdue's doing, and hopefully it can help lead the way for other major universities to see that just because people are here studying at a prestigious institution doesn't mean that they have the funds or access to get the products they need to successfully and healthily manage their menstruation. So.
Well, that's wonderful to hear. That is really so exciting. And especially as we talk about, universities in the United States specifically, there is sometimes kind of a preconceived notion of like people who attend university are wealthy or have access to resources like that. And it is a little bit of a wake-up call for us to kind of hear about these experiences and these testing and kind of like general acceptance of these programs and things like that. And I'd love to take this opportunity to pivot a little bit, since I know you both have academic backgrounds and are based at universities in the United States. And so maybe you have some similar experiences or perhaps differing experiences. But I'd love to get into a little bit of how you kind of got into reproductive health and family planning, and how that's kind of shaped your career path or your outlook on the future.
I got into reproductive health because I think of it as the gateway to every development objective we have. You want to address maternal mortality, enable people to plan their families. You want to address poverty, access to education, climate change, violence prevention, reproductive health and family planning. I could just run through Emory and Purdue's development curriculum probably and say, you know what, I bet reproductive health and family planning would be able to contribute meaningfully to the endeavors we have in this direction. I think it's also one of the least represented, despite my perception that it is that impactful. And yet it is, it's still a little awkward, right? We still don't do a good job as a society acknowledging reproduction. And we certainly don't acknowledge reproduction without the explicit intent of procreation, right? We really kind of struggle with that globally. And so it's a good opportunity to be loud and push forward an agenda that can support broad, unmitigated, equal access to reproductive health and family planning toward that empowered world in family planning, but also all of those downstream effects in environment, in poverty, in all of these sort of stubborn areas in which we seem to have gotten stuck. I think we have an opportunity right in front of us. And so it was just a little too tantalizing and a little too exciting to even consider a career in another space. So that's why I got into it. But how I got into it was a total accident. I was in my undergraduate program and I was planning to study abroad I have a social justice background. So I was looking at post-war reconciliation programs in the Middle East and was planning to study abroad there. But I'll just reveal my age a little and admit that was the semester of the Arab Spring. And so my very last minute, my study abroad plans were shelved and I had a very small selection of alternate opportunities to choose from. One of them was a public health program in Arica, Chile. And so I went and I did a semester there and my world changed and I have never even thought about looking a different direction.
I oftentimes will share my academic journey with students who are trying to figure out what they want to do, because if you look at my path, I am so thankful for the term interdisciplinary, which kind of helps me connect all of the training I had. I started out as a brain and behavioral sciences student at Purdue, and I grew up in the Chicago area. So I was in the Midwest and I thought I wanted to pursue medical school. And ultimately I knew that I wanted to work with people. And I also happen to be a sports enthusiast. I love college sports, especially, but really all sports. And so my senior year in this brain and behavioral sciences program, I took a sports psychology course, and that ultimately shifted my trajectory. And so I moved to Texas and I studied sports psychology for my master's program. So that was a cultural experience for me to, just having grown up in the Midwest, moved to Texas, a little bit of a different political scope there. And so during my master's program, I had a teaching fellowship where I taught basic health courses, or I was the TA for basic health courses for all of these students, and everybody on the campus had to take them. And most of the students at the university were from Texas and hadn't received comprehensive sex education. And so I found myself being really passionate about teaching them the topics related to sexual and reproductive health and serving as a peer mentor for some of the things that they were going on. And I even going through and I saw the intersect, even when I was counseling these athletes and helping them work on their performance, that there was even some intersection with things that were happening in their sexual and reproductive health lives. Like, did they, is their girlfriend pregnant? She didn't take her birth control pill. Those types of things were impacting the way that they were performing. And so I just found myself coming back to that. And so I made my second pivot in my academic journey, and then ultimately went to Texas A&M to study health education under one of the top sex ed researchers in the state at the time, who wrote a lot of the curriculum textbooks. And so it really wasn't until my PhD program that I found a passion for sexual and reproductive health, or started to formally train in the area. So I'm not saying everyone needs to pursue 3 degrees to get there, but I think if I would have maybe sat down and had a good mentor help me nurture some of the ideas that I had, or maybe try out a few different areas, I would have found it sooner. But I'm so glad I found it when I did. And I think all the foundational knowledge in behavior and psychology and the social sciences has helped shape the way that I view the research that I do and the the aspects of all of the methodologies and the theories that I use to formulate my questions. And so it's been a wild journey. I'm happy to be in this field. I am thankful to have this large umbrella of reproductive and sexual health, because I can easily study 800 things and make sense of it, and not, try to convince myself that I need to narrow the scope, because there's so many things going on in this field that are exciting and worthy of funding and research and solutions, and translating the research into action is absolutely my favorite thing to do, to help understand what people are experiencing, what their attitudes are, what they have access to, and then finding a solution and bringing it back to them to help them live healthier lives. So it is a passion. I'm so lucky to be in a field and have a job that doesn't feel like a job. It really is a lifestyle. And I, get excited to do it every single day. And I hope that continues for a long time to come.
Like Andrea, took a really winding path to where I am now. I have a bachelor's in psychology and then a master's in mental health counseling. I was pretty sure that I wanted to be a mental health provider, and then I started doing it. So in mental health training, you do an internship in your last semester where you're actually out there, you're providing mental health under supervision, of course, mental health services. And I realized that I actually really hated this, that I was not meant to be a mental health provider, which meant, okay, I now have this master's. What the heck do I do with this thing that I never want to do again? Ended up working in HR for a little bit, saw so much of what influences people's ability to work. I worked in a disability resource center, and so we were basically part of making accommodations, employment related accommodations, and then helping people transition out if they weren't able to be accommodated. And it was really eye-opening to me how much people had going on in their lives, and recognize that sitting in HR, less HR people, they're very important, but I wasn't going to have the kind of impact that I wanted to have. So pivoted to public health, just happened to be invited to be part of a violence prevention and injury prevention researchers lab. It was a small department. There weren't that many faculty to take students. And she was like, all right, I'll take you. And at that moment, I wanted to do something women's health related. And she's like, okay, well, I have funding if you do injury or violence. I was like, okay, well, what's an injury and violence women's health topic? Okay, intimate partner violence. So it really started down the violence prevention route as a couple of important coincidences. And have really, in my time, much like you said, Alison, I think trauma and violence are at the core of so many social issues. As you were listing all of the things that you thought reproductive health were at the center of, I was like, oh, and trauma. Like, could we add trauma to also being really core to all of those things? And that's ultimately why I started working with Dr. DiMaria, is because when we start looking at reproductive health and family planning, violence and reproductive coercion play such an important role in people's abilities to make family planning decisions and reproductive health decisions. So even though I don't think of myself as a reproductive or sexual health researcher, I think when we start looking at women's issues and women's health holistically, there are so many different intersections, including violence.
Which is why I love collaborating with you. I think that you opened up my eyes to a world of sexual and reproductive health that I hadn't really considered before. And I think our work with our previous doctoral student, Stephanie Meyer, and understanding how conversations about sexual violence can be included in routine gynecological care screenings or visits was, I've been studying gynecology for a long time. I'm not a gynecologist or a clinical care provider, but I've worked along many of them. And it really wasn't until Laura's viewpoints and her training and background to help us really navigate what we were hearing in these narratives when talking to women about why they do or do not engage in routine gynecological care. And so I will bring you in under this umbrella, Laura. I'm so glad to collaborate with you. And I think that those types of interdisciplinary interactions really help make the world better and help make sense of some of the things that are happening in the sexual and reproductive health world.
Yeah, well, I would definitely agree that collaboration is key. And I think that is also going to push us towards the future of sexual and reproductive health. And I know that you've all done a lot of research, particularly around youth and their needs in sexual and reproductive health. And I would love to know, we have kind of an idea of where we're at now and where we're going to be soon. Andrew, you mentioned that, you'd be happy to uptake the next best thing in terms of social media. Right now it's TikTok, and we're loving TikTok. We're loving the content that's coming out of TikTok. And I would love to know kind of where you see the future going, and especially in regards to youth, how can we kind of elevate their voices and make sure that we're prioritizing their needs moving forward?
I don't know how futuristic we want to get, but I'm going to lean on some work that one of my other doctoral students, Jay Ramos Ortiz, did on male hormonal contraception. It is quite interesting to me that the plethora of options that we have for women to use for family planning, including all the hormonal methods, which I think is excellent to have access to those and to have a choice and to find the right option for you. But we're very limited in the options that we have for men, really relying on male condoms and vasectomy as the primary ways to prevent pregnancy. And so there are some options that are available in different phases of clinical trials, including a transdermal gel that is in stage 3 clinical trials. So I think the future of family planning might be related to increased options for diverse people, so that everyone has a choice or an option to have successful family planning, whatever that might look like for them. So I'm hopeful for what's to come to maybe shift a little bit or change the conversations about family planning and placing not just the burden on people who are assigned female at birth, and maybe shift that a little bit to the other side.
Andrea, you are speaking my language. Oh my goodness. So I most recently, before doing my master's, worked with a group called World Vasectomy Day. It's a day, it's in November. It is the funniest job title I have ever had. It also makes me a really fun dinner party guest. But that was so transformative for me, working with them for 2.5 years. My background before that, I was a consultant for big public health NGOs overseas. I worked in HIV principally, but I mean, a little bit of everything from like human milk banking to global health securities to immunizations. And I was also involved in comprehensive sex education. So I fancied myself a fairly educated and competent individual when it came to understanding contraceptive methods available. And I took this crazy on-the-job interview with the folks at World Vasectomy Day in Delhi, India. And I was very appropriately humbled by how little I knew about vasectomy, that it is this 15-minute, no stitches. It is like it couldn't really be easier than it is procedure. And to think that I sat in one of the most privileged and educated positions when it came to contraception, and I still didn't know enough about vasectomy, I think just underscores how not only do we have a dearth of options available for the other half of reproduction, we also don't utilize what we have. We don't think of younger men as candidates for vasectomy. We don't even talk to them early so that when the time comes and their family is complete, they are ready and they've kind of come to terms with that opportunity. We are absolutely discounting. There's such a self-fulfilling prophecy, I think, in the public health world and the policymaker world, that men won't get a vasectomy. And so they don't, because we don't talk about it. We don't make it available. We don't include it in our programming. When we talk to boys, we don't say, hey, have you heard about this option? So that when this is right for you, recognizing that you may still want to have a family, once that time has passed, you've had the number of children you want, whether that's 0 or 10, there's this option for you. And that's that alone, I think, has the potential to be so transformative. I am personally optimistic. I feel like there is more attention on the male engagement opportunities than there has been in my abbreviated career, and that there is this renewed focus about like, oh yeah, wait, maybe involving the other half of reproduction could help us to this end. And I do still think we need to move beyond the paradigm of men as tools to support women, and also start thinking about what are the reproductive health needs of men as well, and how this is a combined unit and not a conduit towards reaching women. But I think we're on a really promising path, and I am super excited to see where these opportunities to get men and boys and women and girls all thinking about men and people with penises in this discussion about reproductive health and family planning.
I think some of the work you're doing around pharmacy vending machines at Purdue also could contribute to this access issue. Do you want to share a little bit about what you've been doing in pharmacy vending machines?
Yeah, sure. Thank you so much. This partnership that we have with the College of Pharmacy has been really great to bring access to a lot of things on campus. Like I said, the birth control program, but also we implemented 2 pharmacy vending machines earlier this year in January 2021, which was the result of some research I had done abroad with students in Florence, Italy, and seeing how vending machines can increase access to health-related products, including sensitive ones like family planning options, pregnancy tests, male condoms, those types of things. And so we implemented 2 in January, and then we just put 2 more on campus because they're being very well received in terms of reducing purchase embarrassment and increasing access, 24/7 access to our campus community. And sometimes it's hard for students. Our campus is large. We live in a desert area where not every student has access to go to places like a pharmacy or a convenience store or other types of shops to get what they need. And so by far the top sellers in our machines right now are emergency contraception, which is in there at a really affordable rate compared to what is offered in our community, male condoms, pregnancy tests, and ibuprofen. So I'm excited to see what's happening with these machines on our campus and how we can get the stock to meet the demand. So actually now with all of the emergency contraception use, I think maybe the bigger question might be, how do we talk about more sustainable and effective family planning method use? So one question leads to another. I'm glad that they have access to it, but wow, we are consuming emergency contraception like crazy around here. Can't even keep the stock to fill the machines every week. So it's been a unique thing that's happening here. So yeah, thanks for bringing that up. I sometimes forget that's a part of this family planning conversation, but it very much is. And I hope other universities, we're not the first to offer them, but I hope other universities can see maybe some of the benefits to bring access to things to their students, like family planning methods through those machines where it's a little bit easier to buy from rather than engaging with another person or walking through a store with a pregnancy test, which can be a little bit intimidating to do.
Yeah, well, I think you've all made wonderful points, and I love the notion that we need to dream big for family planning moving forward, and I think the future is bright. So I really am looking forward to see kind of how we can shift the conversation towards our male counterparts in terms of reproduction, and I'm looking forward to seeing where we can go in terms of research and development about new contraception methods. I feel like the sky is the limit with that. So before we wrap up, I would love to get any final thoughts from all of you, anything you wanted to cover that we haven't yet, or anything you have upcoming that you'd love to plug or promote.
Yeah, I think the access is going to be something we continue to come back to in this world, is just how do we reach people where they're at? How do we better understand their needs? And honestly, I think through this opportunity to be part of the 120 under 40 initiative has opened my eyes as well, especially to all of the global issues happening, because the group and the cohorts are so diverse. So I will be forever thankful to the Bill and Melinda Gates Institute for creating this opportunity, because just like we had mentioned before, no single one person knows it all, and there's not just one solution to everything. So I've learned a lot through engaging through WhatsApp and through doing these series, to listening to the conversations, to seeing the work that others are doing. And I ultimately think that's going to be one of the ways that we learn and we influence each other and we create ideas for what can be possible in different communities. So I just want to give a huge shout out to the Institute and to this initiative, because it's been pretty life-changing for me, actually.
I'll totally echo that. I learned about this 120 under 40 program from a colleague and friend when I was living in Hanoi, Vietnam, Sun Ming, who I think is one of the first cohorts. And he told me about this and this cool program he was a part of, and what he was learning from his peers already, and the lessons he was able to take back to the integral abortion advocacy work that he was doing in Hanoi. And it has been clear from so many people I've gotten to talk to what an impactful thing it is to have this group of folks get to connect and collaborate, and particularly with the Ingenuity Fund and all that it's made possible for us in this work. And we've been able to continue it beyond the initial funding, but I don't know how else we would have gotten it off the ground. And I think the support at that juncture to get good ideas off the ground is really pivotal and transformative, and personally very appreciated.
So thank you again to Alison, Andrea, and Laura. We very much appreciate your time. Is there anything that you have upcoming before we sign off that you want to plug for us?
We've got a couple things in the works. I would just say, please come follow us on Twitter and Instagram. I'm not in charge, which means they're great. So come by, come learn about kind of what we have going on. We are really excited about the ways in which this work is evolving, the partnerships we're growing, and the lessons we've learned, and how they can be relevant to the work of others that might be listening to this. So please come swing by Twitter and Instagram at DignityPack, and maybe one day we'll get a TikTok. So stay tuned.
I will stay tuned for that, or whatever the next best thing is. I think, in my pipeline will just be continuing all of the work that I've mentioned. So the work in menstruation, the work in sexual and reproductive health and family planning, the work with the vending machines and other campus initiatives. So I hope if people are listening and they feel inspired to, reach out if you're interested in coming to train in any of those programs. We offer a lot of great undergraduate and graduate programs at Purdue University. And so I welcome the opportunity to connect on social media or via email. And there's a lot of awesome things going on. I can't give out all of the details, so you'll just have to reach out to get some of the juicy things, but also stay tuned for some of the publications from our TikTok project to come out likely in 2022, fingers crossed. So lots of great things coming at you.
Wonderful. Thanks so much, everyone. And thank you all for listening. We hope you have a wonderful rest of your day.